The idea of motivational interviewing is to move people from one stage to the next. So I'm Dr. Lara Wieland from Australia, and I'm going to be speaking to all of you students and doctors today about motivational interviewing in general practice. Now, this is about helping people change behaviours that relate to their health in a way that is patient-centred. And this is a really important soft skill to learn that often we don't learn in university or in our medical practice, but can make a real difference to our patients and our patient outcomes. So what is motivational interviewing? So it's a collaborative approach where you're counselling a patient and working with them at the centre of the consult, and you're encouraging them to make some positive changes. So it was first developed in the 1980s for treatment of addictions, and the main idea is to help patients overcome their barriers and start talking about change. It's used a lot now in prevention and chronic disease management. So just some steps here that explain the spirit of motivational interviewing. So firstly, it's a partnership. So you're working with the patient and understanding that there can be some real cultural differences around this. So in some cultures, people expect the doctor just to tell them what to do. In other cultures, they, really, want to discuss or ask some questions, and so it can be different. But also even different cultures amongst age groups. So, for example, the older person might say, "Well, doctor, just tell me," but the young person might go and look up ChatGPT and then tell the doctor what they want to do. So there can be some real differences. It's also about acceptance, so respecting the patient's choices and understanding that, what is important to them and what they want to do may not be what you think they need to do, and we need to respect that. Compassion, so understanding the patient's needs and their priorities. And for example, you might have a grandmother, and for you as the doctor, you want them to take medicine, manage their diabetes, but right now the thing that's on their mind is most important to them is maybe looking after their grandchildren. Maybe the parents have some problem or have gone to war or something like this, and so they are just focused on their grandchildren. So you need to understand that and be understanding. And then the last one is evocation, so drawing out the patient's own ideas rather than you just telling the patient what to do. So trying to encourage the patient to come up with their own thoughts and ideas. So then with this next slide, we have in English, we call it the RULE acronym, but I have it here in Ukrainian as well. And that is, the first thing is that as doctors, we need to resist that urge to fix patients. So as a doctor, we get training, we know that if they do this, this and this, it will fix them. And so our urge is just to go in there and do it and tell them you must do this, this and this. But often that doesn't work. So the second one is you understand the patient's motivation. As I said, understand what's important to the patient. So maybe this grandmother we were talking about, for her, it will be important for her to stay healthy so that she can continue to care for her grandchildren. The next one is listen. Listen with empathy. Show the patient that you're listening and understanding their situation. It's very powerful. I have found that patients will trust you more and take your advice more if they feel that you are really, truly listening to them. And then the last one is empower. So supporting them to look after their own health and make some of their own decisions and not just be doing something because the doctor told them, but because they understand why they want to do it. So this next slide, I used ChatGPT and asked ChatGPT to give me a Ukrainian acronym that might be easier to remember, and it came up with DARI, which I think means gifts in Ukrainian. So I may have said it wrong, but symbolising that we're giving the patients a gift and giving them the tools for change. So that's on this slide here. So then what are some of the key techniques that we use? So one is open-ended questions. So things like we could say, what is it that you're worried about? What concerns you about your drinking or your smoking or something like that? Affirmations, so giving the patient some positive encouragement. So, you've shown a lot of strength in dealing with this situation. Or, for example, you may be trying to get them to give up smoking, and perhaps they have given up, they gave up smoking for 2 weeks, but then started again. And you could say, well done, you were able to do it once, so maybe you can do it again. That's because it's really hard, but, well done. The next one is reflective listening. So that's you listening, but you also then say back to them some things that show them that they that you have understood what they're saying. So, for example, I can see that you are feeling very stressed about this. Then summarising is, you could say, let me make sure that I understand what we've talked about so far. And again, like I said, that's very powerful, because if the patient feels like you've not only heard what they've said, but you've retained it and been able to say it back to them, it makes them feel very listened to and cared for. So what is the process of change? So you'll see here on this slide, the first one is pre-contemplation. So that's when the patient's not ready. They say, I don't have a problem, don't want to talk about it. Then the next stage might be contemplation. So, maybe I have a problem. I'll start to think about it. Preparation is the next step, where they might say, I need to do something. I need to make some change. Action is when they make the changes. And then the important one is maintenance. So, of course, when you make a big change, it can be very hard to keep that going, and they need support to do that. So the idea of motivational interviewing is to move people from one stage to the next. So as doctors, we often want to go from, I don't have a problem, to, yes, you have a problem and you must change it today, tomorrow. And if you do this and put the pressure on, often the patient walks away and never comes back. But through these processes, you may move them from not thinking they don't have a problem to understanding, maybe I do. And then maybe the next time it might go to, oh yes, maybe I need to do something. So you're moving them through these stages of change. Now, some of the talk that you want to be hearing from your patient, or understanding some of the words they might use, is if they're thinking about change, they might be saying things like, I want to, or I can, or yes, it would be better if I did this because, and try and tie that into their motivations and what is important to them. And then, of course, they might get to the point of saying, I will, or I am going to. Of course, you've also got some of the talk where they are showing some resistance, and you know that they're in the early stages of this process, like, I can't, or I don't want to, or I've tried before and it failed. And you can use these prompts to think about what you're going to say as well, because, for example, if someone has said, I tried giving up smoking but I failed, I always explain to them that giving up smoking is very hard, and most people take at least 5 times to successfully give up. So you encourage them and say, wow, you gave up once. You can have another go. Let's talk about why you might want to do that. So, motivational interviewing in practice, there's an example here on this slide where we talk about cutting back on drinking alcohol. So you might say, instead of saying, you need to stop drinking, what do you think about your current drinking? Is it affecting you? Does anyone say anything to you about it? Instead of saying, if you don't stop, you're going to have problems, you could say, well, what concerns do you have about your drinking? So there are a lot of applications in your clinical work for this process and these techniques. So, for example, helping people to stay with taking their medication, making lifestyle changes, for example, exercising more, eating healthier, might be giving up smoking, drinking, managing their health better, going to their doctor appointments and so on. So there's lots of situations where you can use this. Now there is a lot of information on the internet around this. You can do entire courses on motivational interviewing. So this is just a little taste and a little idea to get you thinking about this process, but you can look for more information on this. And I can say, as someone who's been a doctor working in very difficult situations for many decades, that this has been a very powerful tool and technique and is really, really helpful. Thank you.